So I thought we should talk about why journal club. You know, most of us think that it is a unnecessary activity and it is a part of the curriculum just because it has been put in the curriculum. But it is actually not that. Why are we learning orthopedics? We are learning orthopedics because we took it by choice. This is one branch, nobody takes it by force. We took it by choice. And when does an orthopedic surgeon want to raise a toast? When he has done a fantastic case. Or when he sees a follow up after 5 years and he's jumping around in recovery. So that's the best thrill in life. And ultimately, this is one of the route to reach there, to give the best healthcare to the patient who comes to you and to be the most satisfied, you being a part to giving the person his mobility and life back. So how do we move further? So I'll just give you a brief introduction in 5 minutes. So the aim is to stay updated, you know, help clinicians, residents, and researchers keep up with the latest research guidelines and innovations in their field. So when we started this, the first presenter came to me and asked me, what topic should I search? I just told him, choose a topic which is relevant to our problems in our department and which are more common and apply to most of us so that it becomes more relevant. Promote critical thinking. So yesterday only I was talking with my team that it is very important that you continue to maintain a fire in your belly to think about problems and not just either have an answer or don't have an answer. I think the in between thing is the best, that you need to think about an answer every time. So it promotes critical thinking. You'll get to know when you go through these journal clubs every a week. Improve clinical practice, that I've already told you. And once you gain knowledge about what is changing in the globe, you'll improve your practice. Enhance research literacy. This is a dying thing which is happening globally. Literacy regarding research. Fortunately, COVID, stimulated this thought process even in the layperson. The layperson were pushing the clinicians that do research, get us the vaccine earliest. So that is where we got reintroduced to the fact that unless you do research, you cannot find answers to problems. Foster discussion and collaboration. We need to learn to discuss orthopedics and collaborate in thoughts and actions in between each of us, so that ultimately we improve the outcome. Support education and exams. Definitely you will get educated, and what is presented here has been chosen by people after putting some time and to give the best relevance to you, and definitely it will help you in education and exam. Exam is not only the exit exam, it is the exam of your life in which you're going to treat patients. So there's a process to journal club. This is very interesting that when we did our journal club as residents, there were hardly any processes in medical research, education, literature, and gradually everything has a process. So even journal club now has a process. It is still not structured totally. There's a lot of flexibility into it. But if we try to frame our own process in our department, it will be most useful to us. Who benefits? Medical students, residents and fellows, practicing physicians. I think that's a very important part of who benefits. Allied healthcare professionals, our paramedics, our other clinicians who come, researchers and academic staff. We still don't have a researcher team or an academic staff in our department, but once this research literacy environment improves, we'll start having more important research going on, and that staff will also be there. What is that staff? That is PhD students. Those are research associates and research assistants who would gain a lot out of these discussions. So quick three-step what happens in a journal club. Before a journal club, you do a pre-meeting preparation on what you're going to do, and the most common way of going about is select an article, assign roles, who is going to read the article, and provide a framework for review, and prepare supporting materials if they are required. As we mature in our journal club presentations, probably every journal club I'll try to bring in a small knowledge about the supporting materials which you need to know about literature, so that we are able to critically analyze each manuscript better. So which article to select is a common thing. So it should be an article from a high impact factor journal, and it should be a relevant topic, and probably it should be a high level of evidence article. So we don't want to discuss case reports. We want to discuss articles which can help in changing our thought process on patient care. So these are three important broad areas which you can consider while selecting. We are already doing the assigning roles. It is a nice idea that senior residents are presenting. It's not a bad idea that even faculty presents. So, if you have not presented journal clubs ever in life, everybody should take an opportunity and present it. We learn out of presentation skills also. During the meeting, there are some basic steps. Start on time, and the article presentation cannot be, reading the whole article. The person who is presenting needs to be understanding the article, summarizing, bringing out the most important things, and laying them open for discussion and critical analysis. Also, these manuscripts are ideally circulated to all the members who are going to attend the journal club before the meeting. We were not able to do it this time because there was a shortage of time, but then now onwards we'll be doing it so that everybody is on the same page and they have an idea what they are reading. And if everybody has read about the same topic, the discussion and the critical analysis is always better. And we try to engage everybody, and especially the quieter people who are a bit not interacting and participating, to take out their skills also at them. And lastly, we'll try to do this. This is a routine thing in most of the journal clubs, that you distribute the summary notes. Journal clubs might not be possible to for everybody to attend all journal clubs, but then whatever comes out of it, the key summaries can be distributed now, especially with WhatsApp groups, and also ask them for feedback, what went wrong and what went good, and maybe we can change it next time, and again look into it and improve it, and plan the next session. So our next session is going to be a week from now, so we should not take more than 2 days again to select articles for the next session. And I would go further also to start thinking for the article for the third journal club. So if we are selecting the article for the third journal club within the next 3 days, then our timelines get normal, meaning then we would be circulating the journal club articles well in time to all of you so that we can read them and come back prepared. So thanks a lot for coming over, and